My name is Mark Cohen. I'm the chairman of the Department of Medicine here at Newark Beth, Israel. Giselle, for reasons which are still not perfectly clear, developed a massive blood clot in the veins of her lower left leg. And it brewed for a couple of days until her left leg became very, very swollen. And in fact, so swollen that it was compromising the blood supply to her leg. And she came to our hospital, and in an attempt to start treating her for that and try to improve the blood supply to her leg, during that time, a massive amount of the blood clot embolized to her lungs, causing her heart to fail and almost causing her heart basically to stop. So a massive amount of blood clot embolized from the clot in the leg to her lungs, and that caused a sudden failure of her heart, and she almost died. The response among the cardiac cath lab staff was immediate and kept her alive with CPR until my colleague, Dr. Visvesvaran, was able to initiate ECMO therapy and keep her blood moving from the right side of her heart to the left side of her heart and basically keep her alive. A couple of hours after that, we realized that the blood clot itself, in spite of heparin, was not improving. So we actually did something we call ECOS and put catheters which were dripping blood clot dissolving medicine into both lungs. And that dissolved the clot successfully and allowed her heart to recover its function. Little by little, our colleague, Dr. Cindy Sturt in vascular surgery, was able to clean out a lot of the clot that was in the leg, which was the original source of the problem. And so we recovered her heart, and we recovered the major part of the circulation to her leg. She was in danger of losing her life and her leg. So being that the clot not just occurred in big veins, but also in smaller veins, it was impossible to get all of the clot out. So some portion of her feet was still struggling to get good circulation and recovery. And that's where the hyperbaric oxygen, which we offer here at Newark Beth Israel, helped a great deal to improve the recovery of her foot. No, she was COVID negative, and we think that she may have a problem with her blood that she was born with that may predispose her to blood clots. But up until she was admitted a month or so ago, she was fine. So we're not sure what triggered it, although she is probably one of those patients who has a congenital predisposition to blood clotting. We were able to take care of Giselle, even though she was COVID negative, and do everything that we were able to do and send her home COVID negative because of the structure that hospital administration had put into place to try as best as possible to cohort patients, COVID positive versus COVID negative. And because of the fact that we have so many different teams, the team that took care of the ECMO, the team that took care of the vascular compartment and surgery, the team that took care of the ECOS, the amazing work done by the intensive care unit nurses in the pediatric ICU. Because we have all these teams that complement each other, we were able to take care of her from A to Z, in spite of the COVID pandemic. So to me, we being able to save her life and get her back on her feet was a very gratifying experience most importantly, besides the obvious that we were able to save her life, which was in jeopardy, and save her leg, which was in jeopardy, it was the working together of many different teams, all working in synchrony for the final common goal of helping this 12-year-old girl. And that kind of overlapping of responsibilities, that kind of overlapping of expertise among different teams, it's a beautiful thing to see all that come together. So when she came to the cath lab after they were trying to help the circulation in the legs is when the embolism took place to the lungs, which caused the heart to stop. Literally, within a minute or two, that was recognized, and cardiopulmonary resuscitation, CPR, was initiated immediately. And in our lab at Newark Beth Israel, we have the capacity to initiate ECMO. ECMO means that we put tubes in your arteries and your veins, and we take over your circulation because your heart or your lungs are impaired. So literally within minutes, the process of taking over her circulation for her was undertaken very successfully by our colleague, Dr. Visvesvaran. And by doing that, we kept her alive long enough to then go to the next step, which was to dissolve the clots that had obstructed her lungs almost entirely, both lungs. Next for her now would be continue to do therapy and to try to improve the circulation to her left foot and to make sure that she stays on therapy to prevent any future clots. So in general, I think her future is bright. And as long as she's on the medication, she should be protected from any further blood clots. Giselle should be able to have almost a normal social life and physical activity life. I can't predict exactly how complete the recovery of her left foot will be, but I think that to a very, very large extent, her social life, her athletic life, her interaction with her peers and her family should be very, very close to normal.